Morning, everyone. I'm Dr. Judith, and today I'll be sharing about how to care for your child's teeth. So this is my daughter who is currently 1, and I must say that after becoming a parent myself, I can empathize so much more with the concerns and the difficulties faced on a day-to-day basis with regard to oral care. So what will be covered today? Teething, tooth decay, oral care, oral habits like pacifier and thumb sucking, tongue tie and lip ties, as well as how to prepare for the first dental visit. So there are 20 baby teeth which erupt over a period of 2.5 to 3 years. Usually the bottom front teeth called the incisors erupt first, followed by the upper incisors, and then the first molars, the canines, and the second molars. So we would be more concerned about the symmetry of eruption rather than the sequence or the timing. For example, here, most of the teeth on the right side have erupted, but not on the left. So this will require further investigation. The timing of eruption varies widely, but generally, if there are no teeth by 18 months old, then you should visit a dentist. So eruption is a slow process. It can take as long as 2 months from the time the tooth outline is seen to the time it fully grows out. So don't panic, just wait. Now, teething often gets blamed for a lot of things, and while it may contribute to some of baby's behavior, it's often not the only cause. So we expect drooling for sure, usually around the time that the teeth are peeking through the gums. If there is a lot of drool, it can also cause a teething rash because saliva irritates the skin. You might find baby be more irritable or fussy. Refusal to feed is common too. So my baby was definitely less enthusiastic for feeds, whether it's milk, feeds or solids, just not as interested. And biting on things is very common, although babies tend to mouth everything as a way of exploration, so whether or not they are teething. Some teething myths, it does not cause fever or diarrhea. Because baby keeps putting things into their mouth, they may easily catch a viral or bacterial infection that way. So any fever or diarrhea would warrant a visit to the doctor. So to ease teething discomforts, you want to consider using silicone teethers or chilled liquid teethers. You might also use a washcloth, just tie it around a ring or knot it at one or both ends and pop it into the freezer. Just remember to defrost it slightly before giving it to baby to gnaw on. We want to avoid teething gels as they usually contain anesthetics like lidocaine, which is actually dangerous when swallowed in large amounts. So when all the baby teeth are out, usually around age 3, many parents will have this concern about gaps between the teeth. So they expect the child's teeth to be quite well aligned with no spaces. But in fact, the gaps help to accommodate the larger sized adult teeth. So here you can see they are erupting behind the baby teeth, which is normal. And the baby teeth eventually become shaky, they fall out, and the adult teeth will then move forward if there is enough space to do so. If there are no gaps, right, then you end up with crowding, and many parents get very distressed about this, but it's actually easily resolved with braces next time. In many cases, we don't extract the baby tooth unless it remains firm despite the adult tooth being fully erupted, because removing it might not improve alignment if there's no space to begin with. So when our gaps are concerned, first, if they are missing teeth, right? In the top photo, we have 2 incisors missing. So gaps will result from the remaining teeth being spaced out in the arch. Multiple missing teeth might be associated with the syndrome. Developmental abnormalities where some teeth are fused or joined together might result in gaps. And a huge gap may arise if teeth are unerupted because of some obstruction like a cyst or tumor. So it might be a visible bulge in the mouth and will require further investigation. Decay at the sides of the teeth may also result in gaps. And lastly, frenal attachments. So gaps between the baby teeth, like in the top picture, it's not really a problem, but treatment might be needed if it affects the adult teeth in future. So as soon as the teeth come in, a child can get tooth decay, and the medical term is early childhood caries, which refers to cavities or holes in the teeth. It's the most common dental problem in children, affecting about 40% of 3 to 6-year-olds in Singapore. So it doesn't happen overnight. It begins as a white spot lesion, which are chalky areas on the tooth surface, often found under plaque. These are painless. When it's allowed to progress, the surface would break down to form a cavity, which over time gets deeper, progressing into the inner layers. And finally, it will reach the nerves inside the tooth. So that's when the child might complain of pain or experience a swelling. Now, decay can affect the back teeth as well. We mentioned that early decay is reversible and easily treated, so we want to catch it at the early stages, right? But unfortunately, it's quite difficult to spot and best done by a dentist. Most parents will only pick up decay in the advanced stages, but by then the treatment required is quite invasive, like crowns or extractions if the tooth cannot be saved. So you might wonder though, these are baby teeth, so do we really need to treat them? Why not just leave it alone since they will eventually be replaced? So decay on the milk teeth can progress, and once it reaches the nerve, your child might complain of a toothache, which can affect eating and sleeping. Severe decay can also lead to an infection. It might be localized, as shown here, like a gum swelling above the baby teeth, and this is called an abscess containing pus. Or it might spread to involve the cheek, causing a facial swelling, often accompanied by fever. So this is, of course, more serious and can lead to life-threatening infections. If the baby teeth get infected, it might affect the development of the adult teeth, which are in close proximity. The damage would range from minor discolorations to more severe defects. So you're right, baby teeth eventually drop, but they don't drop as early as you think they do. The front teeth change around 6 to 7 years old and the back teeth around 10 to 12. So imagine having all the infection going on for so many years. Furthermore, if the tooth is still salvageable, treatment is costly. And if the tooth has been removed, then there is a risk of space loss due to shifting of the neighboring teeth before the new adult tooth comes out. Some parents would mistake stains for this decay. Chromogenic stains might be black or brown in color and can be quite generalized, affecting multiple teeth. And while it looks very scary, they're actually harmless. It can be polished off with a slightly abrasive paste, but it tends to recur. So the cause is chromogenic bacteria, which means colored bacteria, and may be associated with some iron-rich foods like spinach. It doesn't mean that we should cut back on these foods, but rather to just be more meticulous in the brushing to minimize the stains recurring. So what are the risk factors for decay? First, we have poor oral hygiene, right? As a result of not brushing thoroughly, brushing infrequently, or not brushing at all. So many parents will lament that the child actually wants to brush on their own, will not let them brush. But many preschoolers are actually not dexterous enough to do a good job. So another key thing about oral hygiene is that your child needs to fall asleep with clean teeth. That means no eating or drinking anything other than plain water after the teeth are brushed at night. Second, frequent and prolonged consumption of sweet liquids like juices or even milk, be it formula or breast milk. So when it's given to the child on demand for a prolonged duration each time, the drinks can cause decay at the upper front teeth. And lastly, and known to most, frequent consumption of sweets, chocolates, sweet snacks like biscuits and cakes. So the decay-causing bacteria love sweet food. Frequent consumption, right, like eating a sweet or a biscuit every hour, can cause the bacteria to produce a lot of acid, resulting in decay. In particular, sticky foods like biscuits are very high risk, right? Because they take a long time to clear from the mouth when they stick to the biting surfaces of the molars. So limiting your child's consumption of these foods is important. There are some things that we can do to prevent decay. Sealants help to seal off the deep pits and grooves on the back teeth where plaque tends to accumulate because the fissures might be so narrow that they can't be thoroughly cleaned by the toothbrush bristles. Sealants can last many years, but they can be damaged or lost through use. So they do need to be regularly checked by a dentist, and they are very easily repaired if needed. Application of topical fluorides are also useful. You may speak to your child's dentist to find out more about which ones are suitable, considering your child's condition. And while these things help, good oral hygiene is still crucial. So let's look at what cleaning tools are available. So before the teeth erupt, cleaning the mouth is necessary to remove the milk curds that accumulate on the tongue. You can use a gauze, a finger brush, or a brush with silicone bristles. It helps baby get used to things being in the mouth, and we call this oral desensitizing. By starting early, baby also learns that it's part of their routine, so that when teeth come in next time, they are more receptive to brushing. So let's watch this video of me using a silicone brush with my daughter. She had no teeth at this point, right? So it's just for desensitization purposes.
Good. How about the other side here? Count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How about the other side?
Okay, so once the teeth come in, then you should switch to a toothbrush with nylon bristles. The head of the brush should be about the size of a 10-cent coin or just slightly bigger. Once more teeth start coming through and the teeth are touching each other, then flossing is actually recommended. You can use floss holders if they are easier to handle than conventional floss. Toothpaste can be used once baby has teeth, especially if baby is at high risk for decay. So we recommend a minimum concentration of 1,000 parts per million fluoride, and these are some examples. Some have 1,000, some even higher at 1,450, which is the same as adult toothpaste. So you'll see that they specify recommended age ranges, but it actually doesn't matter because the fluoride concentrations are all the same and they all need adult supervision. So how much toothpaste to use? Most children below 3 can't spit or they are learning to spit. So just use a smear amount. And once the child can spit, then you can use a pea-sized amount of toothpaste. Swallowing a little toothpaste is not a problem, but you'll want to teach spitting as soon as they can. So some tips, place a sticker at the sink so it's a target for baby to aim at when spitting. Have baby say the word "to," which puts the lips in the right position for spitting. Model spitting and be sure to exaggerate it. And finally, keep practicing with just a small amount of water. So how to brush? Just a simple scrubbing action, moving the toothbrush left and right. The key is to angle the bristles towards the gums because plaque tends to accumulate along the gum line. So use one hand to brush and then your other non-brushing hand to help lift or pull down the lips. So that would minimize discomfort of the brush hitting the soft tissues, and it also helps you to see better. For toddlers, you can teach them to say E to help close the mouth so there's more room at the sides between the cheeks and the teeth, and then say Ah, opening wide when brushing the biting surfaces. The principle is always go to bed with clean teeth. So try to brush after milk at night and avoid using the milk bottle or latching as aids to fall asleep. So parents often ask them which is better, a manual or electric brush. So actually both will clean the teeth when used correctly. So the brushing technique is the most important. Manual brushes are great to start off with when there are only a few teeth erupted and they are cheaper. Electric brushes should be introduced only when the child is fairly cooperative for brushing, like around age 3. So it may compensate for a lack of dexterity and allows for some independence because it's not so technique sensitive for children learning to brush. The downside is that some kids don't like the sound or vibrations very well. So regardless of which brush is used, we prefer an adult to help with toothbrushing in preschoolers. So if your child insists on doing the brushing, then just let them do one round and then you do one more round after that. So here are some great positions to try. Personally, I prefer doing the brushing from behind as it offers good stability of the head compared to brushing from the front. You also get a better view of the teeth, and with the child more relaxed in that position, the muscles might be less tense. If baby doesn't enjoy lying down all the way, you can use a pillow so they are semi-reclined or cradle in your arms. So brushing can be done anywhere, on the bed, floor, sofa, etc. So just go with your child's preference. Some children may need 2 teeth to brush in a knee-to-knee position, much like how we examine the very young kids in dental clinic. So the child's head is stabilized in your lap, so you get a great view of the teeth when you're brushing, and the other parent helps to gently restrain the arms. So parents always say, but my child hates to brush, so what can I do? We recommend desensitizing them to the toothbrush as the first step, and this can be done outside of routine brushing sessions. Allow the child to explore and play with the brush under supervision. So if the child finds an electric brush very fun and motivating, then use it. For those who are afraid, you might need to start on other body parts first, like the fingernails, and then slowly move up to the face area. Your child can also role play as dentist to brush your teeth. Second, set a goal for each brushing session. For example, maybe the initial goal is just brush one tooth. And then once that is mastered, you move on to 2 teeth. You can brush less teeth at each time, but more frequently throughout the day. Then third, offer choices like which toothbrush or toothpaste, as older children love to feel like they are in control. And finally, keep the routine as fun and positive as possible. Reward with praise or gifts. You need to be very consistent and gently guide the child to learn that it is a necessary part of their routine. Here are some useful links on oral care for children aged 0 to 2 and 3 to 6. You might want to save this page and watch the videos at a later time. So let's talk about oral habits like thumb sucking or pacifier use. These are the there are some dental consequences with prolonged use. The teeth might be crooked, the front teeth might protrude, or there might be an open bite with gaps between the front teeth. So the bottom picture is of a child who is sucking the left thumb, hence the asymmetry in the open bite due to how the thumb is positioned. It may also lead to an improper tongue position and jaw growth. So some pacifiers are marketed as orthodontic pacifiers due to differences in the shape of the teeth, like a narrow neck, or it mimics the mother's nipple better. They claim to cause less of these negative effects, but studies are still inconclusive on this issue. So to minimize the risk of permanent effects on the teeth and the jaws, these habits should be stopped by age 3. And generally, thumb sucking is harder to wean compared to pacifier. So here are some ideas for weaning. You might introduce an alternative comfort object like a soft toy, slowly limit the usage, like maybe only use it for sleep or only at home. Use positive reinforcement like praise or rewards, maybe a big reward if the child managed to avoid use for 5 consecutive days. Constant reminders, which could be verbal or physical, like a thumb guard, or distract the child, maybe trade the pacifier for a toy or experience. For pacifier, you could remove satisfaction by cutting a hole in the teeth. For thumb, you could place a bandage. And finally, to read some books about stopping the pacifier or thumb sucking as part of growing up. So lip and tongue ties, okay, the frenum is a piece of soft tissue that runs between the gums and the lips or the underside of the tongue. So a tie may limit mobility of the lips or tongue, but treatment decisions are usually based on whether it affects functions such as feeding, like whether the baby can get a good seal, especially for breastfeeding. And then for speech, actually most children can compensate without surgical correction unless the tie is very severe. So if speech is the main concern, we would advise consult with a speech therapist before considering treatment. For aesthetics, of course, lip ties can cause some gaps between the front teeth, but the frenum tends to migrate upwards with age, so it may be outgrown. And treatment is usually only needed when it causes gaps between the adult teeth. And that will involve a minor surgery on the frenum in conjunction with braces treatment. For oral hygiene, a tight lip might impede brushing of the upper front teeth, so you'll need to lift the upper lip to reach those surfaces. And it is recommended to schedule the first dental visit by age 1. An early dental check will allow us to screen for decay or any developmental abnormalities. Studies find that children who visit the dentist late, like after 2 years old, they are actually 3 times more likely to get tooth decay. So an early visit also allows us to educate you on the necessary oral care and diet advice specific for your child and acclimatize your child early, which would promote cooperative behavior in the long term. So when they present without any dental problems on that first visit, they are more likely to have a positive experience compared to if they come in with a toothache and they already need an extraction. So it's much harder to re-acclimatize the child after a traumatic dental experience. Some suggestions on how to prepare your child. You may use rewards. Some parents prepare their own gifts and then pass them to me to give to the child at the end of the visit. You may prep the child with role play, cartoons, or reading books about visiting the dentist. We want to avoid any dental threats like if you don't brush your teeth, the dentist will pluck them out. Or avoid words that might instill fear like pain, needle, drill. Sometimes it's quite unintentional, like parents will say, don't worry, it's not painful, but your child might only focus on the word pain. So also choose the happiest time of the day, avoid nap time when the child might be very fussy. And despite your best preparations, expect that there might be some crying and the child might not want to sit on the chair. So we have an infant oral health program at NDC. Babies eligible to join the program if they are 1 year old or had the first tooth erupt within the last 6 months. You can scan this QR code for more information, or you may visit our website. I've come to the end of my sharing. Thank you.